Well, it's a pleasure to be able to share with you some of the updates from the recent World Muscle Society meeting held in Copenhagen. There was quite a bit of new information with regards to spinal muscular atrophy, and the focus really was broken into two parts. The treatment of the symptomatic patient, and the second part being on the identification and early treatment of the presymptomatic patient. On the symptomatic side, we have these emerging treatments. There's now the nusinersen that's been approved in, I think, 30 or 40 countries and is becoming increasingly available almost as a standard of care. And in that context, we're starting to learn more about how that drug works in a variety of populations that were not really studied in the initial clinical trials. So that includes adults, that older type 1 and type 2 patients. And I think we've learned a lot that really all the patients with SMA seem to show a capacity to respond to nusinersen, but they respond in different ways, and our expectations need to be different, whether you're looking at a baby who's been recently diagnosed, or a patient that's lived with that disease for several years, or an adult, perhaps with a milder form. In the United States, we now have the gene therapy that's recently been approved, and hopefully that will become a reality also in Europe and other countries in the not-too-distant future. So at least in the US, the gene replacement therapy for SMA, and it received an FDA label for patients under 2 years of age, regardless of the type of SMA. So we have the clinical trial experience with that, but we're also starting to learn about different populations. So for example, at this meeting, there was a presentation on what's called the STRONG study, and that's the type 2 SMA children up to 5 years of age. So again, while the licensing was just for under age 2, this STRONG study is really important because it starts to give us an idea of how the gene replacement therapy works in older children from 2 to 5 years of age. It's also important because the drug is being delivered intrathecally. It's a single dose, just like for the little babies with type 1, but they're given the drug intravenously. And in the older type 2 children, they're given a single dose, but it's intrathecal. So it's a different route of administration. It's an older population. There's still a lot to learn from that. So there was some exciting information in that regard. And in addition, there's new information that's coming out with the oral splicing modifier risdiplam. So again, updates on their program, particularly what's called the Sunfish Study, some very exciting work that is coming out with that. Now, if you look at the other side on the presymptomatic, we're looking at emerging data on the babies that are treated with nusinersen in the Nurture study, and there was a very nice updated report on that today, showing that that drug clearly works very well. And I think the theme there is early treatment with whatever drug makes a clear difference. But the Nurture data is now maturing, and these babies are now 2-3 years of age and doing remarkably well. Similarly, there is a presymptomatic study with the AVXS-101 gene replacement therapy called the SPRINT study, which is still enrolling, and we need to learn more about that. And then also risdiplam is in just starting to recruit into what's called the RainbowFish study. So at the meeting this year, World Muscle Society meeting, we not only started to learn more about patients who are in the trials and in these open label extension and how they respond to treatment over time, but there are these new studies as well. So quite an exciting time overall.